next speaker, Dr. Greaves, who is going to present to us on STDs from A to Z. Dr. Greaves received his education at McGill University in Montreal, Canada, followed by residencies at Montreal in internal medicine and clinical pharmacology. He also studied infectious diseases at Vanderbilt University in Tennessee, and after an illustrious career at Howard University, went on to serve as the Senior Director of Global Research, Clinical Research, and has now serves as the Executive Director for Infectious Disease at Merck's Research Laboratories, and since 2009, and continue in that role. So he has vast knowledge when it comes to clinical support and oversight in HIV trials, hepatitis C, and many others. So I give you Dr. Greaves, who will give us a presentation on STDs from A to Z. Dr. Greaves.
Okay. Thank you. Thanks very much. And first I'll say I can't cover STDs A to Z because there just isn't enough time. So I'm going to speak about the ones that are most common. And I want to start by saying that CDC and much of the scientific world, we've now moved on from using the term STD, or sexually transmitted disease, to STI, sexually transmitted infection. Because you can be infected with many of the organisms that cause sexually transmitted diseases, but you may not develop a disease. And so the other reason is that the term sexually transmitted disease has a certain amount of baggage that goes with it. But there are at least 25 sexually transmitted infections that we know of spread through sex. All are humiliating and embarrassing. Most, but not all, can be treated and cured. But proper treatment typically includes treating the partner. There are at least 3 things that I think are important for you to know about STIs. They can be spread through a variety of sexual activities, not just through vaginal sex, but also through oral sex, anal sex, genital contact, or through sexual fluids like semen. They can be caused by bacteria or viruses or parasites. They are preventable through lifestyle, use of barrier devices like condoms, and in some cases by vaccines. They're a lot more common than you might think, and in fact CDC estimates that approximately 1 in 5 people in the US has or has had sexually transmitted infection. So this is what things are like even now. Overall, approximately 20 million Americans catch an STI every year, and half of these occur in the younger age group, 15 to 24-year-olds. Chlamydia infections are epidemic, or #1 STD still here in the US. And the disturbing fact is that approximately 1/4 of women who get treated for chlamydia become reinfected in the next 3 to 6 months, mostly because of, poor lifestyle choices. The other important aspect to be aware of is that although gonorrhea has been around for a long time, drug-resistant gonorrhea is of concern and is on the rise. So here are the most common sexually transmitted infections. On the left-hand side are those that are generally curable and typically caused by bacteria. On the right-hand side are those that are not curable, but they can be treated. And these are mostly viral infections. So chlamydia, gonorrhea, trichomonas infection, or trichomoniasis, and syphilis, they can be treated fairly readily. But the viral infections are a lot more difficult. Human papillomavirus, as you just heard about, which can cause condyloma or venereal warts, genital herpes, and of course HIV/AIDS. So how likely are you to get an STI? Some sexually transmitted infections are spread a lot more easily than others during sexual activity. Women are at a disadvantage compared to men, unfortunately, as they're 2 times more likely to get, for example, gonorrhea or chlamydia during sex compared to men. In a single act of unprotected sex, a woman has a 1% risk of acquiring HIV, but a 30% risk for herpes and a 50% risk for gonorrhea. So not all infections confer the same risk. Let's talk a minute about safe sex, because this is promoted heavily as a way to reduce transmission of sexually transmitted infections. But is safe sex really safe? We know that condoms can significantly reduce but not eliminate the risk for pregnancy and sexually transmitted infections. Condoms have about a 12 to 15% failure rate. They break about 8% of the time and they slip off about 7% of the time. During a year of typical condom use, between 10 and 15 out of 100 sexually active women will become pregnant. In several studies, you can see the risk of failure of condoms. This one in Rutgers shows that there was a 35 to 44% risk of developing or acquiring an STI, whether or not condoms were used. In another study in Florida, looking at HIV discordant couples where one was HIV positive and the other one was not, 17% became HIV positive despite the use of condoms. And a University of Pennsylvania study looking at pregnancy risks, 25% of those using condoms conceived over a 1-year period. And there are other studies of condom failure that show the rates vary from 15% among married people using condoms to 36% in unmarried people using condoms. Kissing is not risk-free, and it can lead to several sexually transmitted infections, notably herpes, syphilis, gonorrhea, and more recently we've been seeing more and more human papillomavirus infections in the mouth and oropharynx. Why are STIs still so challenging even today? One important reason is that many infections have no signs or symptoms. So people are often not aware that they're infected and therefore not treated. If you're infected, you're not treated, but infection persists for a long time, there can be long-term damage. And this is particularly true for infections like gonorrhea and chlamydia, where pelvic inflammatory disease can lead to infertility, but this occurs after a long period of time. Similarly, for genital wart infection or human papillomavirus, after a long period of time where everything appears to be quiet and normal, then the woman can develop cervical cancer. And of course, during the interval, while there are no symptoms, infection may be spread unwittingly to a partner. So I want to share with you some of the common symptoms and signs of sexually transmitted infections because this is a better way to think of them. STIs can present as genital sores or ulcers. This is particularly true for herpes or syphilis. They may present as a bad vaginal odor, and this is common for trichomonas infections in women and bacterial vaginosis. They can also manifest as a penile, or in the case of women, vaginal discharge or pain on urination. And this is particularly true for infections like gonorrhea, chlamydia, and one that you may not have heard as much about that is becoming more important called mycoplasma. Then there can be blisters or bumps, as we often see with herpes, and now recently with monkeypox. We talked about genital or oral warts from human papillomavirus, and then rashes or spots on the body, as can occur with syphilis, and now more recently we know with monkeypox. And then there are women who complain of genital itching or rash, and this can sometimes happen with infections like trichomonas infection, but candida is a very important concern when there is genital itching and a rash, although not classically considered a sexually transmitted infection. It often is discovered during a gynecologic exam or in people who present with other sexually transmitted infections. Chlamydia and gonorrhea are the ones that you hear a lot about, and this slide just shows you the slight difference in symptoms in men on the left and women on the right. Either sex can have pain during urination or frequent urination, particularly in men. Women can have bleeding between periods, and in men there's sometimes a watery discharge, but in men there are often few symptoms. But discharge from the penis or watery discharge is one important sign. For women, 75% of women will have no symptoms with a chlamydia infection, but may, over a long period of time, or sometimes with the initial infection, they can complain of a dull pelvic pain or abdominal pain. And occasionally there's a thick discharge with a foul odor, but this number at the bottom is important. 75% of the time a woman may not even know she's infected with chlamydia. Here's another condition you may or may not be aware of called bacterial vaginosis. It's becoming more and more important. At first, we weren't sure this was really something that should be taken seriously, but now we know that it can be very important. On the right, there are several symptoms that you see. There can be a thin gray, white, or sometimes even a green vaginal discharge. It's often heavy and milky. There can be a fishy smelling or bad vaginal odor. Sometimes there's vaginal itching, and there occasionally can be burning during urination. We now know that during pregnancy, bacterial vaginosis can be associated with preterm labor or premature rupture of the membranes and even endometritis. And we talked about prevention earlier, that much of STIs can be prevented by lifestyle, limiting the number of sex partners, and one of the earlier speakers mentioned douching. Lots of women tend to feel that they need to douche to be clean, but this is really a misunderstanding of how the vaginal flora takes care of itself. And douching is one of the things that can really be a risk factor in many vaginal conditions, but in bacterial vaginosis, it seems to be a very important negative practice. So I highlight here, do not douche. And then if you use unscented pads, and latex condoms are also in this category of prevention. Trichomonas infection or trichomoniasis is another common one, typically with a greenish yellow discharge, again with a foul odor, can be frothy, again itching can sometimes occur, occasionally painful sex. Men may have few symptoms. Many cases, again, this is one of those situations where you may not realize you're infected. What we found though with trichomonas infection is that it tends to recur a lot. And one of the reasons we think that that happens is because it's important to treat not only the partners that you may have at the time you're infected, but going backwards, if you're still having sex with partners that you've been with for a long time ago, we now suggest going back as far as 90 days to be sure that those partners are treated as well. Syphilis has been around, I want to say forever, but what's important to know is that there are several stages of syphilis. And one of the tricky things about syphilis is that in the first stage, often the man or woman may have a sore or an ulcer, what we call a chancre. But if you do nothing and you just assume, oh, well, this is just a little cut. Like I've had people in the clinic say, oh, men in particular, I just cut myself in my zipper by pulling up too fast. Zipper cuts aren't really an excuse for syphilis. But what happens is that, particularly men, they will do nothing about it, and this will heal itself typically in about a week. But you're infected with syphilis, and if you do nothing, you can progress to the secondary stage. And the secondary stage occurs much later and tends to manifest itself as, some flu-like symptoms, but more prominently as a rash. Typically a brownish red rash that appears anywhere on the body, but the hallmark is that it can appear on the palms and the soles. So when we see someone with a rash on the palms and the soles, we worry about syphilis as being a possibility that was not treated during the first stage. And of course, this is very infectious and can be passed on to the partner. Then there's a late stage. If syphilis is untreated, it can even involve the brain, it can involve the eyes, it can involve the aorta of the heart, and sometimes it can lead to death. And syphilis in pregnancy is a very important condition to detect and to treat to prevent congenital syphilis and other problems during pregnancy. Herpes simplex is another important sexually transmitted infection to be aware of, and typically caused by two of the herpes simplex viruses, herpes simplex virus type 1 and type 2. Infections caused by herpes simplex type 1 tend to involve more infections in the oral mucosa area, and they're typically also more common among young women and men who have sex with men. That's the abbreviation here, MSM. But herpes simplex virus type 2 is twice as prevalent in women as in men, and that tends to be the usual cause of genital herpes. But because of oral genital sex, we can't be sure when a woman develops herpes simplex virus infection, whether it's herpes simplex virus type 1 or 2. Again, 70% of people are unaware that they're infected. Often we encounter men and women or partners who are fighting with each other. You gave me herpes, I gave you herpes, whatever, whatever. The important thing to recognize is that a person may have been infected and had herpes ages ago, but never had any symptoms. And now the first symptom occurs many, many years later. So it's not safe to argue too strongly about who gave whom what, depending on the time. The way that herpes is spread is by what we call asymptomatic viral shedding. The virus lives in the nerves, but it sheds under the skin, and then direct transmission, either via an open lesion or mucosa, can occur. Shedding is higher in the earlier years or months after the initial infection, and over time tends to decrease. Condoms and antiviral therapy like Zovirax, which you may have heard of, decrease the risk of transmission by about 30% for condoms and 55% for antiviral therapy. Women who have herpetic lesions or have prodromal symptoms, as many women would do before there's an outbreak, are given C-section at delivery. On the right is a picture of what it can look like. These tiny, like blisters or vesicles or bumps here, contain highly infectious fluid that will ulcerate over time. And herpes can occur because it really hides in the nerve. It can affect anywhere in the dermatome. It can affect the buttock area. It can be in the genital area more directly. It can be around the anal area. So any of those areas can be affected. Quickly to move on to HIV/AIDS. You know a lot about this. Primarily viral infection that destroys the immune system and is then characterized by unusual infections and cancers. Now, people seldom die from HIV/AIDS because we've got such good therapy. But there's a huge network of people living with HIV/AIDS around the world, so it's still present. Just want to remind you that this is a problem that's really affected the African American community very heavily, where we account for 39% of the total cases, 59% of the women with HIV/AIDS, and 57% of heterosexuals with HIV/AIDS. Transmission now primarily is through sex, not so much from infected mothers to fetus because of the treatment we have. Still some transmission from sharing needles, and now you rarely ever hear about infection from blood products. There are just a few things I want to mention in the HIV/AIDS arena. Some game changers. We now have very long-acting treatments. There is now a treatment you can give every 6 months, injection. We used to have to take drugs for HIV/AIDS every 4 hours around the clock when this was first diagnosed. There's also now what we refer to as PrEP or pre-exposure prophylaxis, where people can take a pill a day almost indefinitely to prevent transmission of infection from one person to the other. And then there's a new phenomenon which we refer to as U equals U. There are now good scientific data to show that if you can decrease your HIV viral load or the amount of virus in your blood below a level that we declare as undetectable as measured by the testing that we have, your risk of transmitting HIV to another person if you stay on your therapy and the amount of virus is still undetectable is next to zero. So this has given people, I think, a lot more freedom. The science has been helpful in reaching this point. Now there's this phenomenon of HIV/AIDS that's still spread, particularly within the Black community. This has been described on college campuses where men on the down low have been responsible for several outbreaks. These are men who are really bisexual and pass the HIV infection on to their partners. This is just a picture I want to show you. Because HIV/AIDS destroys the immune system, there are many cancers that can occur that are unusual and conditions. Here's a condition called Kaposi sarcoma. So this is something that makes us think of, the person has HIV/AIDS. This is oral thrush, oral candidiasis. While this is not uncommon in babies and in persons who've got cancer or who are immunosuppressed, this is a very, very abnormal in an otherwise healthy young person, and is sometimes the first tip-off that the individual probably has HIV. Vaginal candidiasis is also a condition that's a lot more severe in individuals who have HIV/AIDS and sometimes very difficult to treat. And severe vaginal candidiasis is sometimes the first tip-off again that a woman may have HIV/AIDS. Human papillomavirus we've talked about a bit. This is the busy side, but if you follow me here at the top, the virus is transmitted sexually And there are several types that have been found so far. Only some of them are responsible for increasing the risk of cervical cancer. But at the bottom level here, the virus enters in cervix cells through microabrasions. Several weeks later, the virus replicates. Most of the time, it goes away. Your body takes care of it if you're in good immune shape. But there are a small proportion of people many, many years later where the virus persists and where cancer begins to occur within the cells. And this is just a picture on the right of venereal warts or condyloma acuminata. And these can become massive in people with a weakened immune system, and sometimes they can really cause obstruction in the areas. The good news is that, well, before I get to the good news, let me just say that human papillomavirus can cause cancers other than cervical cancer. I mentioned oropharyngeal cancers before. It can cause anal cancer, particularly seen in gay men, penile cancer, and so on. The good news, though, is that before it gets to the stage of cervical cancer, there's a precancerous stage, and this is why testing, things like pap smears and other tests for HPV virus are so helpful and important. So there are many types of human papillomavirus, but only a few are important for most of the diseases that we see. Type 6 and 11 are the ones that are responsible for genital warts primarily. Type 16 and 18 cause most of the cervical cancers. We've got a vaccine that's very good, and CDC recommends that 11 to 12-year-olds receive 2 doses of the HPV vaccine, 6 to 12 months apart. People who are immunosuppressed, 3 doses are what's recommended. Vaccine is not really recommended if you're beyond 26 years because most of the infection tends to occur earlier and there's not as much benefit at that stage. Coming down to the last one now, just want to mention a word about monkeypox because it's been around in the news. Monkeypox is not new. It tends to occur in certain parts of Africa, Central Africa, Equatorial Africa, and it really just causes very few sporadic cases. Not much to worry about, but recently, since March of this year, as you know, there were huge outbreaks first in Europe, spread to the US. It still rarely causes severe disease. Most people tend to make a good recovery, but stillbirths can occur in pregnant women. In nearly all cases, the rash occurs after fever and tends to be in the extremities, a lot like syphilis and other conditions that can affect the palms and soles. But what's important is that unlike typical cases of monkeypox that occurred previously, the cases this time, the rash was almost all in the genital area, and the disease was mostly in men. So we know from all the studies that have been done since this occurred here in this recent outbreak, is that this can also be transmitted sexually by direct contact. So to sum up, sexually transmitted diseases, they're preventable, they're treatable for the most part. Some are curable. Those that we can't cure, there are usually things that we can do to prevent or manage the situation. So if there are concerns, rather than just waiting to see if something will pass, like as I mentioned with syphilis, things will heal and appear to be normal, you should really see your physician and take care of things.
Thank you so much, Dr. Greaves. Very, very, very helpful information.